Hello everyone. Today in this video we are going to talk about homocystinuria. So before starting homocystinuria, let us discuss the metabolism of the homocysteine. So the homocysteine, by the action of methane synthase and with the help of vitamin B12, it gets converted into methane. Or the homocysteine, by the action of cystathione synthase and the action of the B6 and with the help of serine, it gets converted into cystathione, and this cystathione ultimately converts into cysteine. So this is the basic metabolism of the homocysteine. Now what is homocystinuria? The homocystinuria is a metabolic disorder that constitutes the excessive amount of homocysteine in our body that results in excess excretion of the homocysteine in the urine. That means either we have the deficiency of methane synthase or cystathione synthase. The enzyme metabolizing the homocysteine is deficient or absent. So now let us discuss the detail about the homocystinuria. The homocystinuria is a autosomal recessive disorder. The various causes of homocystinuria are: first one of the causes are cystathione synthase deficiency. So now what will happen if there is cystathione synthase deficiency? If there is cystathione synthase deficiency, the homocysteine will not be converted into cystathione and more homocysteine will be converted into methionine. That means there will be more amount of homocysteine and there will be more amount of methionine. So what is the treatment of this type of homocystinuria when there is cystathione synthase deficiency? So in the diet we have to decrease the methionine intake. Increase the cysteine intake. We should increase vitamin B6 and vitamin B12 consumption and the folate. So the diet containing methionine should be decreased, whereas the diet containing cysteine, vitamin B6, vitamin B12 and folate should be increased, or external administration of the folate or vitamin B6, vitamin B12 should be done. Now another cause is the decreased affinity of cystathione synthase for pyridoxal phosphate. So we have this cystathione synthase. We need pyridoxal phosphate, the help of pyridoxal phosphate to convert homocysteine to cystathione. So if there is decreased affinity of cystathione synthase for pyridoxal phosphate, then there will be improper functioning of this cystathione synthase enzyme. So the treatment for this type of homocystinuria is increase in intake of vitamin B6 and cysteine in the diet. So the deficiency of the cysteine will be covered by the diet, and the deficiency of vitamin B6 will also be covered by the diet. The another homocystinuria is methionine synthase deficiency. In the methionine synthase deficiency, what happened? The homocysteine will not be converted into methionine, but the homocysteine will more be converted to cysteine because of the action of cystathione synthase. However, there will be the increased amount of homocysteine in our body too. So what will be the treatment? The treatment will be the increased methionine in the diet. So another type of homocystinuria, another cause of homocystinuria is methylene tetrahydrofolate reductase deficiency. In this, what happened? There will be the deficiency of vitamin B12 or vitamin B12 or folate. So we should increase the folate consumption in the diet. So we should increase the consumption of the vitamin B12 rich diet. So this all causes like cystathione synthase deficiency, decreased affinity of cystathione synthase for the pyridoxal phosphate, or if there is methionine synthase deficiency or methylene tetrahydrofolate reductase deficiency, these all forms of deficiency results in excess homocysteine, results in homocystinuria. So what are the various clinical features we find in the patient with the homocystinuria? So we find increased amount of homocysteine in the urine, osteoporosis, malformation habitus, ocular changes like downward and inward lens subluxation. We see the cardiovascular effect. Cardiovascular effect is seen because there is thrombosis and atherosclerosis. More thrombosis and more atherosclerosis will lead to increased amount of stroke and myocardial infarction. We can see the kyphosis and intellectual disability. So these are the various findings we see the patient with homocystinuria. So in this video we discuss about the metabolism of the homocysteine, so various causes of the homocystinuria with their treatment, and we also discuss about the various features we find in the patient with homocystinuria. So this concludes our topic on the homocystinuria. I hope you understood this lecture video on the homocystinuria. Thank you.